My name is Lindsay and I'm one of the pharmacy interns here at Mass General Hospital. The purpose of this video is to provide you with an overview of your new transplant medications. As you have likely heard, you will have to take several new medications after your transplant. We like to separate these medications into two different groups: those that keep your new organ healthy and those that keep you healthy. For this presentation, we will be focusing on medications that will be keeping your new organ safe and healthy. These medications are your anti-rejection medications. Each medication works in a different way to lower your body's immune response and to keep your immune system quiet. Your immune system is what fights things off that your body sees as foreign. This can be your new organ or things that cause infections, such as bacteria or viruses. The medication that you receive after transplant will depend on your past medical history. There are a number of medications that can be used to prevent rejection after transplant. The most commonly used combination is that of Tacrolimus or Prograf, Mycophenolate or Myfortic, as well as Prednisone. Most transplant patients go home on Prednisone, but there are a few special cases where we might choose not to use it. While learning about your anti-rejection medications, it is important to be familiar with both the brand and generic name of each, as your healthcare team may use either name. You will have to take your anti-rejection medications for the rest of your life. You should never stop any of these medications without any explicit instruction from your transplant doctor or nurse. If you have received your new medication card from the transplant team, please pull that out and follow along as we review each of your new medications. The first medication we will review is called Tacrolimus or Prograf. This is one of your anti-rejection medications, so you'll be taking this medication for the rest of your life. For Tacrolimus, there are several strains, but we will be focusing on the 1 mg strength capsules. It is dosed every 12 hours, and we dose it based on your blood levels. And when you take your blood levels, make sure to take your morning Tacrolimus dose after your blood draws, and your blood draw frequency will decrease as you get further out from your transplant. Common side effects that you might experience include tremor, headache, tingling in your hands and feet, and hair loss. In terms of food, you can take it with or without food, but make sure you are consistent in what you choose. Important interactions to avoid include grapefruit juice, as well as Fresca. There are many interactions with other prescription and over-the-counter medications, so always check with your transplant coordinator or transplant pharmacist before starting a new medication. The next medication is called Mycophenolate sodium, or Myfortic. This is also one of your anti-rejection medications, so you'll be taking this for the rest of your life. Though there are two different strains, we will most commonly use the 180 mg tablets to allow for dose adjustment. And like Tacrolimus, Myfortic requires a twice-a-day regimen, so 12 hours apart. Some common side effects of Myfortic include diarrhea, nausea, vomiting, and heartburn. It could also decrease your cell counts, so we take a close look at your white blood cells and your hemoglobin. We recommend taking it with food in order to prevent stomach upset. And for interactions, we like for you to separate your Myfortic from antacids, so that includes Tums and Maalox, as well as separating from other supplements, including calcium, magnesium, and iron by at least 2 hours. So say that you take your Myfortic at around 8 a.m., then you can take your supplements at either 10 a.m. or 6 a.m. And Myfortic could also lower the level of hormones and birth control as well. Some special instructions include not crushing, chewing, or cutting the tablets. And we recommend that pregnant women should not be handling these medications, as it can cause some fetal harm. Female patients of childbearing age should also use 2 forms of birth control as well. Lastly, we have prednisone, another anti-rejection medication. For this medication, your prednisone dose may differ depending on your past medical history. Most commonly, you'll be taking this once a day in the morning with food, and doses will decrease over time, also known as tapering the dose. You'll be taking this in the morning with breakfast to prevent any stomach upset or difficulty sleeping. Some common side effects include increased blood sugar, mood changes, and trouble sleeping. If you have high blood sugar or diabetes prior to transplant, you will likely require insulin or higher doses of insulin after transplant. And we also like to recommend having an eye exam once a year to prevent cataracts. These are other anti-rejection medications that we may choose to use in our patients who are unable to tolerate our standard anti-rejection regimen. Your transplant team will provide education specific to these medications. So these include Envarsus, cyclosporin, azathioprine, sirolimus, everolimus, and belatacept. The main take-home message is that you will be taking 2 to 3 medications to prevent rejection of your new organ for the rest of your life. If possible, we recommend separating your antacids and your supplements from mycophenolate by at least 2 hours. And make sure to not crush or cut your mycophenolate tablets or open your Tacrolimus capsules. And as always, make sure to take your anti-rejection medications as directed by your doctor.